Hi, my name's Kevin Courtney. Welcome to this second briefing about coronavirus and schools following the wider opening of schools on the 8th of March. We've now had schools open for 1 week, and you wouldn't expect to see a lot of change as a result of a 1 week opening. This chart shows the total number of infections in England as spotted by the ONS. The last date on this chart is the 1st of March. The date there actually goes up to the 13th of March. That's the Saturday at the end of that first week of wider opening. And you can see that this chart shows that cases have continued to fall, although the rate of decline of that fall has become a lot less and the curve is starting to flatten. On this chart, we show the graphs for all of the nations of the UK, and you can see there is variation at some points in it. But what we think is notable is that the Scottish curve has started to increase, and we do think that might well be due to the wider opening of primary schools in Scotland from the 22nd of February. This chart shows the geographical variation, and it shows that cases have improved slightly from the 6th of March to the 13th of March and have become more even. It'll be interesting to see how this changes over the coming weeks. If we look at the school age reporting that we get from the Office of National Statistics, it's important to say that this is reporting from a random survey, so it doesn't depend on children having symptoms, and it shows that there's continued to be a decline in school-age pupils, but that decline has really moderated across the last week. When we compare that with all age groups, last week we talked about between November and December that secondary school cases and primary school cases were well ahead of the all ages number because schools were open when everyone else was closed, and the increases in schools had been leading the increase in all ages. At the moment, all ages and primary and secondary are more or less at the same sort of level. There's a little indication in this perhaps about secondary opening. These are positive lateral flow tests. Now, since the 8th of March, almost all the lateral flow tests done in this country have been done on secondary school pupils. And we can see here that on the 8th of March, there were just about 800 positive lateral flow tests. On the 15th of March, there were 1,200. That was on Monday of this week. And on Wednesday of this week, around 1,300 positive lateral flow tests. They are largely in secondary schools, and it may be that they show some increase in transmission between secondary school students. We all have to do everything we can through ventilation, mask wearing, social distancing to try and keep transmission down as much as we can in our secondary school settings. There is the good news on this hospitalisation chart showing the sharp decline, and on this deaths chart also showing a very sharp decline. But it's important to remember that hospitalisations and deaths are lagging indicators. So they are responding to the fact that cases fell sharply a few weeks ago. Maybe also vaccination starting to have an effect, because that will also be reducing hospitalisations and deaths. Our concern will be if an increase in cases from schools opening or other widenings eventually means that the case curve starts to go up, and then the hospitalisation and deaths curves flatten off and maybe also start to increase, and that will be something we'll want to watch for. On attendance at school, you can see the little green line on the right hand side shows that when primary schools opened, almost all children started back straight away. The sharp purple increasing line shows that some students in secondary schools were back on Monday. Actually, almost all of them were back by Thursday of that first week, but we didn't have a full week of secondary opening in that week of the 8th of March. Next week, we'll see the result of that first week of full opening of secondary schools. 1% of students were absent because of coronavirus in that week of the 8th of March. 5,000 of them had confirmed COVID, either by a PCR test or an LFT test. 7,000 of them were at home because their parents suspected they had COVID. They had symptoms, so they may or may not have actually had COVID. 64,000 were at home self-isolating, and about half of those were close contacts of a school case, and about half of them were close contacts of a family case, so not sent home by school. 2,000 students were at home because their school was closed. Given the average size of a primary school, that may be 8 or 9 primary schools being closed. And on the next chart, we say a little more about that. This chart shows the clusters or outbreaks of coronavirus. Now, a cluster isn't just one case. There'll be lots more single cases. It's not even just 2 cases. It's a few cases. An outbreak is where Public Health England think the transmission actually happened in that setting. And these are education settings here, but the brown bar, nurseries, shows that there were 19 clusters or outbreaks in nursery settings out of 25,000 settings. There'll be more where there was a single case. The green bar shows that there were 13 outbreaks or clusters in primary schools out of 16,000 primary school settings. Again, there'll be many more where there was a single case. The yellow bar shows that there were 8 outbreaks in secondary schools out of 4,000 settings, and the light blue bar shows that there were 8 outbreaks in special schools out of 1,000 settings. If you look back to weeks 50, 49 of last year, you can see that there were many more outbreaks. So we'll have to see what happens across the next few weeks. Another effect of schools opening might be shown on this chart, which shows that there is slightly more travelling to work. So some parents who had to stay at home because their children were at home are now travelling back to work. That's good for them, but it might lead to more cases again as a result of more travelling, and that the government will be worried about that, and we're worried about it. There is still the good news on vaccination. Even though there may be this slight constriction in supply, it is true that by the 14th of March, that's last Sunday, 48% of the adult population had had a vaccination and a further 8% had booked. During this week, vaccination for 50-year-olds opened up, and the NEU emailed all of its members in England who were 50 years old or higher to tell them they could book. We've had very good feedback from that. Lots of people making their NHS booking from the email that we sent them from the NEU. The NEU is working on COVID in a number of other ways. We are continuing to maintain our school COVID map. This is the latest data from the school nearest to NEU headquarters, and happily here cases are continuing to fall. Let's see what happens. Keep an eye on the area around your school. The NEU got constantly updated advice on safety on our coronavirus webpage, and lots of good policy advice, pedagogical advice on the education recovery plan on these pages.